do ACL surgery for a living, but obviously, we have an interest in educating the community, and if we can prevent an athlete from being injured, that's certainly our preference to do that.
OrthoArizona sports medicine specialist Shelden Martin is the head team physician for the Arizona Rattlers. He tries to bring awareness to this condition with his annual Rattlers ACL Injury Prevention Clinic at the Talking Stick Resort Arena.
So let's look at the intercruciate ligament and the anatomy of the knee.
Valley student athletes, coaches, physical therapists, and athletic trainers got a chance to listen to Martin's presentation and learn how exercises from the Spooner Physical Therapy crew can help in preventing ACL injuries.
This is the patient population that has the highest rates of ACL injuries, football players and soccer players. And really that young female age category between 15 and 25, they're the most vulnerable right now.
They're between a jump and a hop. Jump is 2 legs.
Our goal is to get all those athletes back out in the field. When we look at it, the reason it gets so much attention is the duration it takes to get back out. It's anywhere from typically 6 months to a year. That's a long time. That is dedication, that is commitment to be working that hard for that amount of time, and then to make sure that you're doing that to perform well, to minimize risk of injury again.
Spooner Physical Therapy is another partner in this ACL injury prevention clinic with OrthoArizona. Tori Foster is the clinical director in Scottsdale.
So many people miss out on hitting all 3 planes of motion when it comes to the training. The exercise that we do to prevent an ACL injury, or the exercise to some degree at different levels that we do for the rehabilitation as well.
The 3 planes of motion Foster is talking about are sagittal, front to back, frontal, side to side, and transverse rotational movements. Doing this during training can increase an individual's range of motion and prevent injuries.
This is the first time I've actually got a chance to be in the room with the professionals and understand precisely what's going on, ask questions, ask follow-up questions, learn about the current research, and then, of course, I'm much more zeroed in on the preventative side.
Corbett Hess is with Excel Soccer Academy in Phoenix. He plans on bringing some of what he learned at the clinic into his team's warm-ups.
We're not going to be able to do all of those things in a particular night, but over the course of a training curriculum, that we make sure that, night in and night out, that we're hitting all 3 of those planes to make sure that we're doing what we can as coaches to help protect our athletes.
The student athletes not only got a chance to learn about preventing ACL injuries, the clinic included a tour of the arena and watching the Rattlers in action.
These athletes want to play sports. They don't understand, what the ACL is, why it's torn. They just want to play sports. And so I think increasing that awareness and that education can potentially help these kids decrease their injury rates.